now tuned in to the Cold Hard Truth, Cayman's #1 hard-hitting live podcast show, where we feature some straightforward conversations on political, social, and celebrity news and all things happening in the Cayman Islands and around the world. This show was created to give the people a voice and a means of being involved and informed without any filters. Sometimes it gets crazy, but we always keep it real. We bring you the tea, piping hot, so grab your favorite beverage and join the conversation via WhatsApp at 324-1612. Email tips@CaymanMarlRoad.com. Now, here's your host, Sandy Hill, broadcasting live from the beautiful Cayman Islands.
Miracle Brokers International is a shipping, moving, and logistics company. You get all our expertise in one stop. Our motto is shop, ship, and save. All shipments are important to MBI and will track your items during shipment, clear through customs on arrival, and deliver to your door. MBI will spend the time in lines to get your cargo for you so you can be more productive with your time. Miracle Brokers, the solution broker. 345-925-5989 or miraclebrokers.com. Delivering these days can be frustrating. You can either wait forever or pay insane prices to get it faster. Even then, you still have no idea when it'll reach its destination. That's where Miracle Brokers comes in. We are flexible, reliable, and most importantly, fast. Whether you need household relocation, delivery services, full custom brokerage, overseas consolidation, commercial moving, packing materials, overseas consolidation, or inter-island moving, we offer exceptional logistics services all around the world that suits your individual needs. Just choose when, where, and what your delivery will be. You can even get it delivered same day. What's more, we'll choose the best courier for you based on your delivery requirements. This means less waiting and less hassle for you. Because we don't just say we care, this and much more make us a great option for you. Discover our shipping solutions and more at miraclebrokers.com today.
Okay, good morning, everyone. Everybody's like, where are you? Did you get partied out last night? Well, hardly. Thank you guys so much. My voice is like a frog this morning. And not only is my voice like a frog this morning, but I have a little bit of a sore throat. I don't know why. I'm thinking, was I doing any exorbitant yelling or screaming? Nope. So I'm going to keep an eye on that. I'm having some tea this morning to try to keep it at bay, whatever it is. And of course, I've got my tall glass of water. My friend gave me a nice glass with her company logo and everything as my morning cup, and it did not last long. I think that you know, what can I say? It is, my daughter got a hold of the cup. So, 4-year-olds and anything that can break will break. So let me just, sorry. I'm going to let my tea cool down a little bit. So we have a couple of things this morning that I wanted us to perhaps just have a little bit of a discussion on. And one of those things is there's a petition in circulation. I do want to check the petition to see how far they've gotten. When I last checked it last night, it had over 500, I think it was close to 500 signatures, so not exactly over. So let me just check the petition and see where they've reached. So basically, this petition was started by a local attorney, but she's also a parent. And I know that she's in some of the parents groups like KY Mommies, and also I think she might be in the Real Women of Cayman, but those groups have a lot of side discussions in terms of what's going on in the community. Now, there has been a little bit of an argument that they are overly expat, let me just put it that way, and that they don't necessarily represent the voice of the average Caymanian who has to live and work in this country without the benefits of, the expat population does live a very different life. And I don't, that's not saying anything to insult anyone, but I do think that there are differences in how people live in this country. And it's important for all of us to recognize that. because sometimes we hear a story or we hear something that we cannot relate to, and then all of a sudden we start thinking to ourselves, well, I just adjust this out a little bit. We start thinking to ourselves, well, is this really true? And truth is, there's shades of truth. There are, so many things I think that come into play. So thank you, Cassidy. It was a very good birthday. Nothing super crazy happened, to be honest. I had a fabulous late lunch with a girlfriend and my husband and my daughter. And then I know another girlfriend wanted to come over and do a little cake at the house, but unfortunately, she has a young child and she has to put her daughter down by a certain time. So her daughter goes to bed very early, and I wish my daughter went to bed early, but Gianna does not. A lot of you were wishing me happy birthday on social media, so thank you so much for that. And I appreciate all of the birthday greetings. Some people are saying, "Oh my gosh, your daughter looks so much like you," and I think. The funny thing with my daughter, she looks a lot like her dad. And from day one, she's looked a lot like her dad. So everybody's like, no, she looks just like her dad. And so I think when she was first born, definitely she looked like him. She had this super dark hair and it was like lots of it. And it was really, really straight. I mean, now it's kind of got a little bit of curls in it. And so I think people kind of saw him initially more than me. But now that she's gotten into the toddler years, and when people see my younger photos, they're like, wow, she does look a lot like you. So there you have it. I guess a combination of both. But good morning to John, Gina, Cassidy, Spellman. Let's get into the conversation. Olivia, Dominique, and everybody else who's tuned in this morning. Thank you so much for tuning in. So the question is, to mask or not to mask? So this petition has started. It now has 587 signatures. So what I understand about, I've actually never done a petition on change.org, but apparently you start your petition and I guess it sets a number. And then when it reaches that number, it ups like what your goal is. So right now, initially it said, let's get to 500, but it's not necessarily that the petitioner had set it at 500, because I was a little bit confused about that. So I did speak with this young lady, Pratna. She's actually an attorney here in the Cayman Islands. And she said, no, she didn't set that, like it was at something before, and then it went up to 500. And I guess once it gets to 500, then it goes up to 1,000 and it keeps going. So right now it says, let's get to 1,000, and it has 587 signatures. And basically they're petitioning the government to reconsider the wearing of masks. Now, this is a very interesting conversation. Let me just grab some of my COVID notes for the day, because there's a lot going on in the world of COVID. So, it's a fairly simple petition. Do you allow kids to wear masks or not? I can certainly understand the concerns about kids feeling like they have to be forced to wear a mask all day in schools. First of all, I must say that it is difficult to wear a mask, even as an adult. I cannot imagine the people who are in, those positions where they have to wear masks when you go to the grocery store and stuff, how uncomfortable that must be. Because I do see some workers wearing masks all day long. And I'm thinking, oh my gosh, I'm stifled after like half an hour, that literally. So even during the height of COVID, that's why I just stayed home, because I couldn't, force myself to wear a mask for extended periods of time. So when I would go in the grocery store, I tried to be very focused about what I needed to get and to try to get in and out. Because even within the grocery store, I was, pulling down my mask, getting a breath of air, and then putting it back on. Now, I don't know if that is a situation where the mask isn't the best material. I do know that the very first mask that I had, the material seemed to have made a difference in how comfortable it was to wear. And then, that improved with the subsequent masks that I got. So I think material does matter. And this is where, as parents, if you're thinking about, how to protect your children and, being compliant at this stage, because the government has not responded to this petition as yet, and it doesn't look like they are going to change it. So we'll see eventually what happens. But I think the comfort of masks are important. So we have Amazon offers all sorts of masks now. You can go in there and you can buy masks that run the gamut in terms of, what they look like, how they are. And the new ones that are actually the clear shields where they're like attached to like a little nose bridge thing, and they almost look like little glasses. And then they shield your entire face. So not just here, they actually shield your eyes as well, because remember, your eyes are an entryway into your body. So they're a membrane, a mucous membrane, just like your mouth or your nasal cavity. So I think a lot of times people forget about the eyes, and obviously a traditional mask covers just the nose and the mouth. It doesn't cover the eyes. But listen, if you touch an infected surface, or a person who's infected gets in close contact with you and they sneeze, and those particles go not just up your nasal cavity or your mouth, but they can get into your eyes and permeate the body and stuff as well. So there's that. So I think that the plastic shields offer a better level of comfort. I've not actually personally used any of those, but they do look so much more comfortable. And I see people like in the salons using them, because in a salon it gets hot. Sometimes they're using chemicals and stuff that make it already a challenge to breathe. And so being scuffled or covered with that is another potential discomfort in them trying to do their jobs. Now, there was somebody who tried to prove a point in the US. I can't remember who this was, but they went out and ran for an hour exercise or something, just to show that, listen, wearing a mask is not that difficult in terms of breathing. But I think it does depend on who you are, and probably what your lung capacity is. And I don't know if I'm a shallow breather or if I have a little bit of claustrophobia going on here. But at the end of the day, it is challenging, I think, for some people. So the question becomes, do we send our children to school with masks or not? So on the one hand, the argument is, listen, we do not have any active cases of COVID-19 in the Cayman Islands. However, we do see how quickly that could change in a matter of just a heartbeat. So New Zealand went 102 days not being aware of any active cases. And I think this is the difference, right? Not being aware of any active cases and not having any active cases are obviously two very different things. So you may not be aware of something, and they say, what's that old adage about ignorance can kill you? So what you don't know can be very, very dangerous and very, very deadly. So the question is, although we do not have any active cases here in the Cayman Islands, we continue to test every single day, and every single day we'll do, I think over the weekend and Monday, there was over 600 tests that were done. And then yesterday there was another maybe 200 or whatever. So every single day they are testing, they're testing. And, they are realizing that the people that they're testing are all testing negative. Now, who are those people, though? That becomes the question. Borders have been closed. So obviously, we know a portion of those individuals being tested would be persons who were actually coming into Cayman and in quarantine. So as they're being released from quarantine, obviously, they are tested to make sure that they do not have the virus and they're not releasing anyone with it into the general population. Who else is being tested? A lot of frontline workers are still being retested. So these are people who've been tested in the past, and there's a certain protocol that some of them have to be retested again. So for example, banks, the banks have been retesting, I think, every 4 weeks. So we don't know a breakdown of those numbers in terms of, are they more new unidentified people who've never been tested before? Or do those numbers represent a large number of individuals who are persons who've been retested, who are being retested, I should say. And so there is that question for sure. So at the end of the day, I'm a little bit on the fence on this. I have to be honest with you guys. I'm not really sure as a parent how I would feel if my child was in school. And the petition does say that there is a marked difference between kids under 10 versus kids who'd be more like in middle school age, who are a little bit older and they're better able to manage themselves. So part of me understands the argument, part of me gets it. And then the other part of me, which is very, very logical, also says that, um, there is a very likely possibility that we still have persons who could be infected here in the Cayman Islands that just haven't been tested. So although the chances are slim, there can be clusters. So New Zealand, let's take this as a test case. They went 102 days, which is a substantial amount of time, months, without a single COVID infection. And then now they have somewhere between, I think, 61 or 70 as of yesterday. And remember last week, it was just a family of 4. Now it's up to like 70 people or something ridiculous. President Trump is having a field day with this because he keeps saying that New Zealand is having a massive outbreak or something, he called it. And the president of New Zealand took offense to that. The prime minister, I think she is actually, of New Zealand, Jacinda Ardern, she, took offense to that, saying that basically President Trump has his own issues that he needs to be concerned about. And when he talks about, what's happening in New Zealand and the fact that this outbreak is massive and all sorts of terms that he was using, that maybe he needs to look in his own backyard before he attempts to make any sort of negative comments about New Zealand. And by far, I had a few drinks yesterday, and I don't normally drink, so hello. They were so fruity and delicious, I must tell you. So by far, New Zealand has actually done a really good job, but they do have a cluster of cases in Auckland, and then they have another lady who, like one new case, she's a lady in her 50s, and she actually returned from New Zealand from Kitara via Sydney on August the 14th, and she is currently in isolation in a hotel, but she also has the coronavirus. So the prime minister has said that she thinks the numbers are somewhat encouraging, and she does not believe that the numbers represent anything that is exponentially expanding. So it's interesting because at the end of the day, it can happen. So that, New Zealand clearly demonstrates that we do not need to get too comfortable with our negative numbers. She's increased the number of defense personnel that are now monitoring the borders just to make sure. And by the way, last week when we were discussing the situation in New Zealand, we were talking about the possibility that it may have come in, the virus that is, on a frozen container. But they have now said what is being called New Zealand's second wave of infection actually is not linked to that container or any containers. So they did go back to the port. Because remember, in that household of 4, there was one person who worked at the port, and there are concerns that in other places, China has claimed this and so on, that there is the possibility that a virus could survive under the right temperatures. If the temperatures are cold enough, it could survive on surfaces for longer periods of time. So now they're saying that they are ruling that out, that they do not believe that that is the source of the infection. However, they don't know what is. They don't know where this cluster is coming from. And so does that mean that they were just people who had it all of this time and they just didn't know, they just weren't being tested. And then as symptoms started to develop, as it was passed on from one person to the next, then someone, because remember, a lot of people are asymptomatic. Was it then a case where those persons were, you know, getting a little bit sick and decided to get tested? It's a big question. No one seems to know. So President Trump, the Washington Post, the New York Times, everybody, and NPR, everyone is reporting that President Trump has said that this is in the words he used, to be precise, was big surge in New Zealand. So again, the prime minister, of New Zealand is kind of like, Trump, get it together, because you've got your own big surges happening in every single state almost. So she has responded to Trump, saying that Trump is patently wrong about his assertion, and that the two countries are not even comparable in how they've handled the pandemic. And by all accounts, the US has failed at handling this. I mean, let's just be honest, right? And she goes on to say on Tuesday that we are still one of the best performing countries in the world when it comes to COVID, and our workers are focused on keeping it that way. And his comments were made on Monday after New Zealand reported an additional 9 cases. But again, that number has gone up to at least 61. Some reports were saying 70, and some reports were saying 61. So in New Zealand, their death toll is 22 from the virus, and they have a population of about 5 million people. So by comparison, the US has a population of around 330 million. So definitely a difference in size for sure. And they have had 170,000 people die from the disease. But of course, even if you compared it, if you broke it down by mortality rate per 100,000 people, which is kind of how you do like the statistical comparison for countries who have different populations, that basically means that they have a mortality rate of about 52 deaths per 100,000 in the US, and New Zealand has 0.45 deaths per 100,000. So again, this is according to the Johns Hopkins dashboard, which is kind of like the go-to location if you're interested in tracking any of the statistical information on the coronavirus. So this particular report says that New Zealand has 90 active cases driven by a new cluster in Auckland, and only 6 of those patients are currently in the hospital. And they had gone 102 days, like we said, without a known infection. And so they will continue to obviously monitor that situation. Let me see what some of your comments are. So what do you guys think about this petition? Should the government reconsider making it mandatory for children to wear their mask all day long when they're inside? If they go outside for playtime and whatever, then obviously they do not have to wear a mask. Someone recommended, why not have part of the classroom day outside? And I thought that was interesting, although it's pretty hot here in the Cayman Islands, so I don't know how comfortable kids would be. But someone made the suggestion to split the day, where you're indoors some of the day, and then you go outside to get fresh air for the rest of the day, and you make it, I guess it depends on what subjects you're teaching outside. It may not be quite as easy to do that. And it's not like you can ask kids to just pick up their desk and move outside. You know what I mean? So, but it's an interesting suggestion. So let's see. Spellman, good morning. Dominique, good morning. Olivia and Cassie. So Spellman says masks are the first anti-COVID resources. And again, we know that they are effective, and we have seen time and time again the information. So here's a demonstration of why wearing a mask. So this is where one person is wearing a mask versus 2 persons wearing a mask versus no mask at all. And you can see that the transmission of those small particles and of any virus, but in particular the coronavirus, is substantially reduced when both persons are wearing a mask. So, you know, It's just one of those things where masks help, masks protect people. I think Spellman makes a valid point. It's not the only line of defense, but it is certainly when you're out and about and you're around people, especially in closer quarters, it is a first line of defense. Remember now that researchers have shown that in a classroom environment, in particular in small spaces, you have a situation where, you know, this virus, the smaller particles can travel up to 16 feet if someone coughs or sneezes. So, in my mind, the question then becomes, with the petition, what do you, as parents, what do you want? So the government was saying, listen, we know that you guys want your kids back at school. We have worked very, very hard as a country to try to get our numbers to the point where we feel comfortable and confident saying, yes, our kids can return to school, because they've been out, doing virtual learning for months and months and months since March. So here we are going into the new school year, and now your kids are in a position where they can return to the classroom, albeit with certain restrictions. So they're returning with masks, they're returning with sanitation stations, encouraging them to wash their hands more frequently and sanitize, and maybe temperature checks, and all the teachers are going to get tested before going back into the classroom. There's some people that think the kids should get tested as well, which I think probably wouldn't be a bad idea. So the compromise is we can open back our upper schools on the advice of the medical experts, the health professionals. We still believe that masks have an important role to play in the community in terms of in social spaces and in public spaces. I saw a couple rumors circulating early this week and late last week saying that, government was going to make an announcement that people did not have to wear their mask any longer in public spaces. And I don't see the government doing that anytime soon. And what I found about that commentary is, my question becomes, why do you think, because everybody's like, well, we need to get back to our normal lives. Why are we thinking backwards, right? Why are we thinking about going back to how it was? Why don't we move forward with a new normal? So what if our new normal is this way of thinking, wearing masks, sanitation, all these types of things? That's the new future, because the coronavirus is not the only thing that's going to be emerging in the area of healthcare that's going to cause us a lot of concerns. So good morning to Sandra Whitaker, Miss Janet. They're watching from my personal page. Miss Joy, good morning to you. And Chance from Cayman Brac is also watching. So thank you, Sandra, for the comments that she hopes I feel better. Yep, it's just a little tickle in my throat, but I know when I feel that, that's normally a good indication that something is coming. So I adjust my habits. I start eating garlic like a vampire. No, vampires don't eat garlic. Vampires are afraid of garlic. I start eating garlic like a vampire hunter. Yes. So I will start a course of fresh garlic, which has some antibiotic properties, as we all know. And of course, things like tea and a little bit of detoxing. So thank you so much, Sandra, for those comments. So Spellman makes a good point. Cassidy, good morning, Irvin. Cassidy has a few comments on this. So Cassidy says, I believe eye coverage is also as important as wearing masks. Good. It's hard for adults not to touch their faces, much less the little ones. Reducing the length of time they spend in school during this time will be critical. And the eyes are just as vulnerable if one touches an infected person and forgot to wash and sanitize your hands. And this is exactly what I was saying earlier. And then you go and you touch your face, you touch your eyes. Absolutely. I agree with that. So I think that Cassidy is in agreement with the wearing of masks. And she's also talking about the importance of trying to cover your eyes as well. So let me just have a quick look, because there were a couple studies that I wanted to mention about, let me just see, about children and how they transmit the virus, right? So there are a couple of studies that have been done. So one talks about, let me just bring this up on the computer screen here. I'll send this. So one talks about children's infection rate. So let me just grab this. So this is some really important information because we are still learning quite a bit about this virus. And so there's information, for example, about how likely are children to get the coronavirus, how likely are they to be vectors of it. So in other words, they're more likely to transmit it to other people in their household than them necessarily being sick from it, right? But we've seen the youngest of the youngest dying from this as well. There was a very interesting article talking about the mask. This year's must-have back-to-school item is actually masks for children. So they're saying that, listen, you've got your Crayola box, you've got your, other things that you're putting in your school bag, your crayons and pen and pencil. But the one thing, especially in the US, that is now becoming a new normal is the wearing of masks. And there are companies who are like, listen, they're ready to make their coins, to make some money off of this mask wearing situation. They don't see it going away anytime soon. And so it is what it is. So for example, they will now be designing, so big names like Crayola, what's this other company called? Old Navy, Disney, they're all designing, because they're trying to make money, they're all designing colorful masks for children. And there's a number of designs that I've seen that are super cute, that kids probably, wouldn't mind wearing. There are people here on island as well who are doing custom designs. So if you have a school uniform, there are people who will design a mask to fit your child's school uniform. So I think that as parents, we need to get a little bit creative. My daughter, at first, she's only 4, she was really afraid of the whole mask thing, because she's like, why is everybody, we didn't want to explain too much in terms of COVID to her, because, her level of understanding, obviously, as a 4-year-old is not what it is as like a 10 or 12-year-old. So here's some Crayola design masks that are cute, that show like different moods, like how you're feeling for the day. So your kid can pick up, if they're feeling a little bit grumpy or whatever, they can pick up maybe the green mask, the red one. If they're super happy, the yellow one looks like more of a happy face. And the orange one looks a little bit like a shocking, surprising face. So these companies are doing a lot in terms of design work and making it more fashionable, if you will, where your kids will want to wear a mask and they won't mind it. Now, what I find with children, and you guys can tell me what you think as parents, that oftentimes they pick up on our vibe. So if we're anti-mask, if we're anti, them staying out of school, and they hear these conversations in our households, and they kind of are paying attention to maybe what's going on in social media, if they're old enough, they will adopt a lot of those same viewpoints, whether that's actually their viewpoint or not. Because children are very absorbent, even well into their teens. That's why we talk about things like social influences. Social media influences them. They've got peer pressure that influences them. So there's a lot of considerations in how your children might be reacting to a situation and how they may be saying things. And really, they're just sponges. So they're taking in what's happening by and large in their environments. I think you got to be careful what messages you hear your kids with. So when my daughter first saw people in masks, she was scared. She's like, why are people wearing a mask? It's scary. I don't like it. And so we had to explain to her, that people are sick right now. And to try to protect ourselves as well as protect other people from potentially getting this virus, it's now required that we wear masks. And we mentioned the word police, and she kind of was like, oh, well, if the police say it, so they know that there's authorities in place who tell us to do certain things. So to ease her into wearing one herself, when it came to the point where she was going to start going out and about, we actually had some custom masks designed for her with the characters that she's into right now. So Pepper Pig. So she's got a Pepper Pig mask. She's got a Frozen mask. And her little face is so tiny that when we first had them done, we had to have them resized because literally they were falling off. So now she knows anytime we go out and we're going in a public space, she'll say, "Oh, mommy, where's my mask?" She's asking me for the mask. She's seeing us. We stopped by the coffee shop last night on the way home, and we got our little donut. And yeah, she's saying that, you know what, my parents are wearing a mask. I don't try to complain about mask wearing in front of her. Although, like I said, for me, I do find it a little bit uncomfortable. I don't make it a big deal in front of her. I just put it on and suck it up. And so she's like, "Where's my mask?" And I'm like, "It's right here in the bag." So there is that, of course. And then the other thing that I thought about, I want you guys to tell me what you think on this note, is the fact that some children may not have access to different types of masks. So, in our schools, especially in government schools, the haves and the have-nots are not so noticeable in school because of the wearing of school uniforms. So everybody wears a school uniform. So no one is wearing like fancy clothing or designer outfits. Everybody's in the exact same school uniform. So you don't necessarily get to show off. That's the best word I can think of right now. Your wealth or lack thereof based on how you're dressed and your clothing. Once you keep your uniforms in decent condition, everybody's kind of looked at some level the same way by their peers. But mask, now, how will that work? Will the children supply their own masks? Will government be supplying generic masks, like the disposable ones? Some kids let their masks get so super dirty. They're not washing them and sanitizing them like they should be. So there's little details that I have to tell you that I was wondering about in terms of how the masking will work. Like if I were a parent, I love these masks. Like I said, my daughter has Pepper Pig and Frozen. I would be one of those parents that would get a mask from like Crayola or Old Navy or Disney to kind of have something that's a little bit different, something that's a little bit interesting. If she was in a situation where she had to go to school every single day, wearing a mask, I would have like 5 masks. So at least every day she's able to put on a clean one and then we wash for the week, just like how we do her clothes. There might be children who can't afford to have 5 masks. So is the government then saying that they will be providing masks at no cost, even if it's the disposable ones, to these children? Will they have, masks readily available? Because, kids, they forget everything. They forget their books sometimes and their backpacks. And God knows if they were not wearing the clothes on their backs, they might forget those as well. So, if they forget a mask, what's the protocol? Is the school going to provide them with masks, or are they going to be sending them back home because, oh, you forgot your mask? I think it would ease parents' minds, and this is why a lot of parents are like, why are we not having a press conference at this juncture, knowing that school is starting? School is right around the corner. I think next week, some of the government schools in particular start doing orientation, and they're getting back into the swing of things. As of Monday, actually, I think some of them start their orientation programs. So why is it that we have not had a press conference in over a month? Why is it that we're not hearing from the education minister on these different things where she can tell us in precise terms exactly how this will work? The guidelines that are issued by the Ministry of Education do impact private schools as well. So we've seen the government did a PR report or press release this week saying, okay, this is what they've done. Sanitation stations, they had, I could see in the photos, members from Public Works there who were, moving desks around, measuring, outfitting, different things. What about the private schools? We haven't really heard anything about the private schools. Are they privately communicating with just their parents in terms of what procedures they will have in place and how will that work. But of course, they have to set, if government says, listen, these are the guidelines, mandatory guidelines, and this is what we require, then everybody else has to fall in line and follow suit. So in the US, they're encouraging parents because, of course, their situation is very, very different. They've got serious outbreaks. And we saw again that photo of the overcrowded high school, right? So in the US, they are saying by and large, listen, let's take this as a positive, right? Don't see this as a negative. Psychologists are saying this is a positive thing. Encourage your children to wear masks. It's not the end of the world. It's something that can be seen, like I said, as an accessory. They can be bright and colorful. There's a Dr. Andrew Adisman, who's the chief of developmental and behavioral pediatrics at the Cohen Medical Center in Queens, New York. And he said, let your children see face mask as a positive thing. Pull away this negative talk about it, right? And he's been quoted as saying the reality is if you want your children to go back to school in the safest way possible, having child-friendly masks in terms of fit and appeal are probably part of the solution more than the problem. And again, I do admit that the situation in the US is very, very different, but most of them are calling for their students to wear masks in the classroom. So in some areas, it's not a directive, but it seems to be good universal practice. So here's statistically what we're talking about. So there's a study, a fairly large study from South Korea that found that children younger than 10 transmit the coronavirus much less than adults, although the risk is not zero. However, children between 10 and 19 can spread the virus at least as efficiently as adults do. And then there's another study, because you know how these studies go, that was in a pediatric magazine on Thursday. So this would have been Thursday of last week, that said that children can carry their coronavirus at high levels. So this study found, now just to be clear about this study does not prove that infected children are contagious, but it shows that they do carry it. And so they've been testing kids throughout the US, and they're finding that young children, as young as 5, are mostly, while they're still kind of mostly spared by the coronavirus, that does not mean that they're not vectors of the virus and that they are carrying it essentially. So they're carrying it in their noses and their throats, and that they are infected as much as adults. And children younger than 5, now listen to this, this is a little scary if you have young kids. Children younger than 5 may host up to 100 times as much of the virus in their respiratory tract than adults. Ew. So again, I don't know why that is, but like I said, there's a lot of unknowns about this virus and people are still very much learning. So let me return to some of your comments. John, good morning. Hi, Gina. Carol, sorry, says children in Southeast Asia wear masks all day. And it's worse out there, no air conditioning, dry, polluted. They survive and do exceptionally well out of school. Carol says, I do appreciate if children have gone to summer camps without masks and everybody can go to a crowded bar without masks. Why schools? But wearing a mask will not harm your child. So Carol is in support of wearing a mask. So I think that's an interesting comment about South Asia and those countries and how they do it. Let's see who else is. Good morning, Morna. Hi, Alma. Alma says it may be a challenge for teachers to get younger children to keep the mask on all day. And I agree with that. I think that they may not be able to teach otherwise, because that's just how kids are. They will take them off. And even when they're talking, it muffles your voice so that they can't hear each other. I see them pulling it down right away. Edith is an agreement that they should wear masks until all persons are tested and all are negative. Now, here's the thing. I've been saying this for a while now. As small as Cayman is, why not test the entire population? Why are we wasting test kits? I don't want to say wasting like wasting, but you know what I mean. Why are we using test kits, these PCR test kits, retesting people? I get that they're on the front lines, but why not test everyone in this country? We could do that. We could honestly test every single person in the Cayman Islands because we are that small. It is that manageable for us. That's why our success story, in part, has been our success story. Because of our size, we could shut down our borders quickly. And we've seen Jamaica. Jamaica has over 3 million people. They're struggling. They've reopened their borders. They actually had a case that was imported from Jamaica into, I think, Bermuda or something. So, you know, there are other countries around the world, other Caribbean nations, who are now looking at Jamaica and thinking, oh, we need to start shutting our borders to Jamaica, because most of the Caribbean kind of has this relationship where we're like, okay, we're a little bit lower risk than like the US, and you know, that break there is a bit much. So we're considered a low risk country. So I just had a parent who went to Jamaica. They're en route to the US with their university child. And they said that in Jamaica, they got tested once they arrived. But other than that, and they tested negative, there was no concerns for anyone coming from the Cayman Islands because we are considered a low risk country. And so because of that, we get preferential treatment in terms of entry and not having to go into any kind of mandatory quarantine. But of course, they said that their main concern, so this person says to me that we arrived on Thursday in Jamaica, and although we took about 2 hours to get through screening, as other flights in the US had just arrived before us, once we passed the health screening where temps were taken and some more detail, we were free to go. So I don't think that they actually tested them because they are from Cayman. But then they say no tracking, no quarantining, etc., as Cayman is a low risk country. However, this person's concern is when they are getting their student visa sorted out, taking their child from there to the US is kind of where it gets a little bit scary. But listen, Jamaica has cases and they've been importing a lot of cases. So even you being in the airport, transporting your child is a risk. You know, it is a risk. So that risk is substantial depending on where you're at. Okay. So yeah, I mean, sorry, I'm just sending a quick. All right, so let's just see. Morna, Alma, Karen, good morning. Quincy, good morning to you, my friend. Rachel says, great visual. Yes, about the mask. It brings the point home. Louise says, mask up, Cayman, home economics. Making masks could be productive. Design and material in different climates is important to understand. Lead the way, Cayman. So Louis is in favor of masks. Sue admits that it does present a big challenge, and all teachers should be tested right. So this gets back to my point. Why have we not just tested everyone in this country? Like, it would have been so easy to set up testing stations and to ensure that every single person gets tested. And then if you get to 90% of your population that has been tested and you have no positives, the chances of the 10% having anyone infected with the virus are really slim. But right now, we don't have any information, to be honest. to indicate what portion of our population we have truly tested, especially knowing that we are retesting. So I do think that people have a little bit of a false sense of security about what the present situation is here in the Cayman Islands. And that sense of security, just like New Zealand, can be a very dangerous position to be in. So Sue was saying test all the teachers and kids going back. And if they wear hats and PrEP and CIS, they can wear the plastic shields. I think the plastic shields are a much more viable idea than a traditional mask that's like right up against your face. And the question then becomes, Sue, is who's selling these plastic shields? I've personally not seen any, but who is selling them? Where are they available? Has anyone brought them in like large numbers? Like that would have been fantastic in order to make them available to people. And again, there has to be some consideration of, how to distribute these materials, how to distribute these masks, especially for kids who may not be able to, or who may not have had a mask all of this time. So Rachel has a different approach. Rachel's saying that it's actually easier to start with a rule and then relax it than suddenly try to implement it later, as all parents and teachers know. So she's saying, hey, maybe this is what government's thinking. We go in with the mask, we see how things go for like maybe the first month. I'm sure kids will get the seasonal flu and will get sick otherwise. And you start testing those kids, which I agree with Sue. I think all kids going in should be tested. But you start testing them later on as they return to school. And maybe it then becomes a situation of, you're able to relax the regulations a little bit. So a good point there, Rachel. Rachel also says, good idea to let Cayman kids to practice wearing masks and get used to it before we reopen our borders. Sure, it will be a bit tricky at first, but we are lucky to be low risk while the kids get used to it. Kids are adaptable. Parents can help by being supportive and making it part of the new normal. Yes, Rachel, and that's exactly what these professionals around the world are saying. They're like, listen, don't get into this narrative that this is a bad idea. Let your children know that this is the new normal. We're moving forward, not backwards. Let me just see. Yes. So this narrative then that kids aren't so susceptible to the virus and that kids are not getting it is not true. We now know that for a fact. They are getting it. They may not necessarily become as ill as some other categories, but they definitely do get it. And so they're probably expecting, especially in the US, to see as the schools reopen, greater number of kids, because again, they're going to be, exposed to each other. They're going to be getting it for sure. All right, so I've got some additional statistical details here. In terms of the coronavirus, let me just see. All right, so I was doing a bit of research last night in preparation for the show, which, by the way, we did not have a show last night because I was enjoying my little family time for my birthday, so forgive me for that. But I was quite tired actually last night. And so I got my birthday presents. Thank you so much. There's a few people who still are like, I need to take you out for lunch for your birthday. No problem. We can continue to celebrate for the rest of August, baby. We got all of August to get this done. So John says, John is back to work. So John, have a beautiful, productive day. So I do know that the numbers, post COVID on this program, although they're still very, very good, people are returning to work. And so sometimes people don't have data to be able to watch like in the car and stuff like that. So you can go back, John, watch it later in the day or when you get to work if you're at a desk. You can kind of listen to it in the background. So Rachel says field shields allow breath vapors to leak through the sides and the base. Ooh, since cotton mask work, simple cotton mask work and regular outside mask free breaks for kids will help them get relief, or teach outside in the shade, mask off. So Rachel makes an interesting point that I hadn't really thought about, is how effective are those shield masks? Okay. Yes, because they do have openings. So obviously it's not quite the same as having it right against your face. So let me look into that, Rachel, but I think that makes logical sense, to be honest. So Sue says some boys love to wear masks, and I think, again, you can make it fashionable for the girls. And yes, government can definitely hand them out as part of the school uniform. So Karina says, test the whole population. And she's going to change her mind about sending her son to preschool next week. Now, Karina, I wonder, have you spoken to wherever your son is going to preschool? Have you spoken to that preschool about what protocols they have in place for the children? Because, for example, for my daughter, she has returned to school and they have made some significant changes. There was only 6 kids per classroom, so no more overcrowding, 1 teacher per classroom to reduce the number of adults that are coming in and out of the environment. Kids have a sanitation station as they arrive, so they get temperature checked. They get sanitized with a spray, hopefully. I mean, I'm almost scared about these sprays. I'm like, what's really in that bottle, right? So, okay, so they also have, they're 4 years old, so keep that in mind. So they have a dedicated mat per child, and those are socially distanced. I don't know if it's exactly 3 feet, but it's definitely more than what they would all share a mat before, kind of thing. So they've socially distanced them as well. And they know that when they walk into the classroom now, they take off their shoes before going into the classrooms, and they put them all in a designated area, which is something I think all preschools should do anyway. Like, I'm glad that COVID has made people think about sanitation and the passage of like viruses and germs and that sort of thing, especially with younger kids. Because, the second your younger kid goes into school, they get sick with everything under the sun. And that's because they are around. And I mean, in some ways it's good because it helps them to build up their immune system. But, every other week you got a sick kid in your hands. And there could be measures in place that were taken. So now they're washing their hands as part of the sanitation station. And that's perfect because it teaches my child, I know for sure, she is way more into hand washing these days. Like, everything now is like, I got to wash my hands. I got to wash my hands. I'm like, good, go wash your hands. Whereas before, I was having to prompt her a little bit more. Go wash your hands, honey. Now she's like, no, I need to go wash my hands. So she's really on the ball. And so I think all of these things help to reinforce good behaviors and good, habits. So I think that that's good. So Karina, I wonder if you've asked your daycare or your preschool what measures they have in place to address some of these concerns that you as a parent may have. And preschools, At that age, I don't think if you're under 5 that you have to wear a mask. So your child wouldn't be subjected to the mask wearing as a mandatory thing. So perhaps have a consideration. I don't know whether you were saying you changed your mind because of the mask or because of the petition, but preschool kids are not going to be forced to wear masks because it's impossible really to force them to do that. The other, there's something else I was going to say about the wearing of masks. Yeah, so my daughter, they've got, like I said, the little mats now that they're stationed, and you'll hear her referring to her mat like she was on her mat doing her school activities, coloring, or they have arts and crafts and different stuff that she has to adhere to. So Mary, good morning, beautiful Mary. She says, I'm all for safety, but is it healthy to wear masks all day? I just think it's a double standard. We'll walk into a restaurant with a mask, but take off once at the table. Adults can go to a bar, lounge, or nightclub with no mask. Like I said, it's all for safety and appreciate the measures taken by our HOGG. What does HOGG stand for? So again, Mary brings up the point that as adults, we are less restricted, even in dining out and so forth. Once you get to your table, you can take your mask off. I don't know if the assumption is still that you are eating with people that you know, but you may know them, but you may not necessarily be exposed to them. But then again, it's also impossible to eat with a mask on. So maybe that was a bit of impractical advice. But I think Mary made 2 comments here. So she says, what's the logic? My daughter ordered a shield for a 5-year-old, but was told currently only masks are allowed. Oh, is it safe to keep a mask on all day? I appreciate all of our government has. Okay. Well, there goes that shield idea. So I guess you need to check. You definitely need to check with your schools to see what is allowed and what isn't, because here I'm thinking a shield would be a great idea. Rachel's pointed out the shields are not as effective, which is obviously a concern. And then Mary has just pointed out that there's some schools who are saying no shield, it has to be a mask. Again, it has been proven that wearing a mask for long periods of time, I think it depends on a number of factors, because masks can interfere with your breathing and can cause you to go into what's it called again? But I think, to be fair, there is a lot of evidence out there that people wear masks every single day, all day long. Like medical professionals are wearing masks, and some of them are wearing multiple masks. So the debate, I think, of masks being safe, which they do decrease your oxygen intake, versus the potential of getting the coronavirus, I guess you're weighing the lesser of the 2 evils, right? So we had looked at the possibility of someone inhaling their own, what they call toxin inhalation, like recycled air. There's an actual name for it. I'll see here in a second. Can have some negative impacts, but I'm not so sure that we've heard of anyone really having this yet. So one person said that Americans in particular aren't used to wearing masks. And I think that people are trying to find reasons not to wear the mask and question everything. And that it's really not as big of a deal or as complicated in terms of the dangers of mask wearing than people want to believe. So there's an article in the Wall Street Journal that talks about the dangers, a hidden danger of masks. And what they say is that masks actually promote a false sense of security. So as masks become a cultural symbol, to resist them is nothing more than selfish, claims this person. Yet the science is far less certain about the moralism. So this is an interesting article. Okay. Well, there's a lot of debate around this topic, folks. So Karen says, well, I give them a call. I gave them a call and they weren't really helpful on that information. That I would be concerned about. Maybe you need a new daycare, a new preschool. The lady didn't know if the school has those protocols. Call the preschool in West Bay, no answer. Karina, that is alarming because not only should they know that, but the education department has mandated what they have to do. So let me just find the article and I'm going to refer you to this article for your own benefit so that you can read this, because I'm shocked that anyone could be running a business like a daycare and not know what the requirements are. So bear with me. I'm going to pull up this article here. And there is actually, it's called Back to School General Guidance for Schools, Early Childhood and Education Centers. So this is the link. I'm going to post it in the comments. Share this with these people who are running daycares, Karina, and telling you that they don't know what's going on. Because if they don't know what's going on, that means that they're not going to be taking necessary steps to protect your children. And folks, this is beyond concerning. I would never have allowed my daughter to go back into a preschool environment where the management of the preschool would say to me, well, they don't know what the protocols are or how they were going to be keeping my kids safe or whether they had to wear a mask or not wear a mask. My God, this is a 30-page document, folks, that is very comprehensive. And this is where the Cayman Islands government now does things that are worthwhile, and we still want to sit back and criticize the government for what they do, when in fact, people are not even paying attention. Why devise a back to school general guidance for the reopening of schools, early childhood care centers, and education centers after mandatory closure due to COVID-19? This is dated June the 20th, so it's been around, or June 2020. It's been around for a couple months, and parents and teachers and schools still don't know what's going on. Folks, the Ministry of Education put this 30-page document together for the benefit of these exact administrators. So get it together, right? Get it together on a serious note. So they've got all sorts of stage return to on-site schooling. What does stage 1 mean? So some year groups, nursery, reception, years 1, 2, 6, primary, and years 7, 10 through 12, and all students in specialty units will return to on-site schooling first. Discussions and arrangements for Creek and Spot Bay primary will be held. The existing remote learning program will not continue for these year levels. So they're talking about stage 1, and they go through, they talk about attendance, hygiene protocols. So the wearing of mask. Sorry, I've got someone trying to ring me. I'll have to ring them back. The wearing of mask, cleaning of high contact surfaces throughout the day. So they now engage, janitorial services to be on site, on location, going around cleaning all day long. High contact surfaces, let's be clear what they are, folks, because I see this happening all the time. All the time. Light switches. Most of us touch a light switch. Hundreds of people come in and out of a bathroom and they're touching light switches, and come in and out of a room, they're touching light switches. Nobody ever cleans the light switches, folks. You got to start disinfecting everything. Doorknobs. Doorknobs are a big high contact surface. What else do people touch a lot? Obviously, carts in grocery stores. Now everybody knows that that's a high contact surface. So that's important. If you go to the bathroom, the toilet, what's it called, handle, where you flush the toilet, If you're smart, you wouldn't be touching that, folks, not with your bare hands. You take a little bit of that tissue and touch it, flush it, and drop it in as it's flushing. Faucets. Now, some bathrooms are getting a little bit fancier and they have the sensor type faucets that turn on the water when you put your hand underneath. Those are much safer. Here's one that nobody ever thinks about. You go in a bathroom. What's the first thing you do? You lock the door. So you take the little lock the door. When you come out, hands are dirty, infected with God knows what. You open it. How many bathrooms do you think? Right? When staff clean those bathrooms, they go in there, they give the toilet a little whirl, they clean the toilet, they spray. How many people do you think, cleaners, are actually disinfecting all sorts of handles? So including, because that means that you have to get in to the bathroom and you have to close the door and step back a little ways to clean that handle and disinfect it. How many, cleaning companies do you think, or helpers or cleaners or whatever, are actually doing that? Probably not very many. And these are all very high contact areas. So good morning, Marshall. So Karina, she's mentioned the school. Message me, Karina. I think it's going to be challenging to get your child in, especially with, like I said, in my daughter's school, they only have 6 per class now. So depending on what age she's at and what group she'd be in, most kids have returned. But, as kids are moving on, like she's going to be moving on to another school. I don't know how old your child is, but there would be opening in that particular class. So, I think you got to look around, PM me, DM me, and I will give you some information on this particular school that my daughter goes to. But I'm sure that there are others out there who are taking the necessary protocols. You just have to know who they are. So like I said, I'm just a little bit concerned that someone has said to you who actually is in the office or management of a school that they don't know what these protocols are, because if they don't know what they are, they can't possibly be enforcing them. So yes, folks, I put the link here. Send that to that school, Karina. Tell them to please educate themselves, because it is through education that they will be able to protect your child, other children, and I dare say even their workers. So some school staff are considered high risk. So anyone aged 60 years and over and have a chronic medical condition, or of any age and have a compromised immune system. Now, someone sent me something last week, I think it was, saying that there was a private school on Island that basically told teachers do not return if you have a pre-existing condition. And so the person sending it to me was like, this is discriminatory. And I thought, it is, but it's also protecting that person because they're the most at risk. And I don't know how to feel about that. On the one hand, it makes total logical sense that you do not want to expose a teacher if they're high risk, if they're diabetic or they have some pre-existing condition. Listen, even hypertension for COVID is a pre-existing condition. That could be a lot of teachers. That could be a lot of people. So, yeah, I get how it seems a little unfair and discriminatory, but it's also trying to protect them and their lives and, potentially the spread of the virus to others also. So, some of these guidelines, they talk about recruitment of new staff are for public schools only. So it's going to talk about that. Because there will be certain protocols that new recruits will have to go through in terms of being placed in mandatory quarantining and that sort of thing. And some of these guidelines, like they talk about nursery class, child attendance, Again, they need to look closely at this to see what protocols they should be following. So they have a nursery class staff. It talks about the different things under that section. So all staff are expected to volunteer for testing prior to the return of children, irrespective of whether or not they have any symptoms of coronavirus. Staff who are sick or have any COVID-19 symptoms are in isolation, have come into contact with an infected person, or awaiting the results, obviously cannot return. Staff will not be required to attend school if they have a medical certificate indicating they are unfit for or unable to work. They have an ECCE space ratio. So that's early childhood care education centers. The requirements as per the education regulations of 20 feet of usable indoor space per child is in effect. Outdoor space can remain at 40 square feet per child. So these are very, very specific, folks. Like I said, someone took the time to make this. It's divided up into different sections. It talks about trauma, being diligent and interacting with children, picking up on things, because unfortunately children are under a lot of stress as well. That's why the mobile health and wellness unit that has been going around to all the different districts, which by the way, they should be in Savannah area now. They left Georgetown. I think Friday would have been the last day in Georgetown. So hats off to the Red Cross. Folks, take advantage of these initiatives that are in place for the benefit of your children, right? You want a healthy child. Let me just see. Carolina, I think, had sent me some information a couple of days ago. You want to have these things available for your children. So Tuesday, which was yesterday, August 18th, they were at the Cayman Islands Baptist Church. Today, that was Peter Castle. They are going to be at the International College of the Cayman Islands. So let me just post this, because I do want you guys to have this information readily available. The more information you have, the more you can move forward in a positive direction. So let's try to keep your kids safe. If you notice that they're suffering from undue stress or trauma, then by all means, get them the help that they need. Children with learning disorders and disabilities are in a very high risk category at the moment. So again, do the best you can as a parent. All right, so let me see. Marshall says they just have to clean everything. Yes. Evelyn, I spray mine every morning when we get home. Every evening, sorry, when we get home. No one is home anyways. Yeah. So Mason wants to know what's going to happen if a teacher tests positive. Well, they can't be in the school. They have to go into isolation. So what will happen to that class or students? Are there plans to place a sub for those teachers? Just wondering. So the idea, Mason, is to test teachers presumably before they return to the classroom environment, so that they don't go into the schools and into the classroom environment and potentially contaminate anything. Because that is Mason, that's a great question. So prevention is always better than cure. So if you're pre-testing them before they go into that environment, I would say that the chances of anything coming out of that in terms of having to shut down an entire facility because one or two teachers have tested positive is a very good thing. Okay, so let me take a little break at this time. We do have some other information that's happening around the world in terms of COVID that, to be honest, is quite shocking and alarming. It's just like people are so ready in their brains to just return to normal, what they consider normal, as quickly as possible. And that means that they are just ignoring all protocols and throwing good common sense out the window. And it is so foolish, folks, and so incredibly dangerous. We'll be right back after these messages.
Miracle Brokers International is a shipping, moving, and logistics company. You get all our expertise in one stop. Our motto is shop, ship, and save. All shipments are important to MBI, and will track your items during shipment, clear through customs on arrival, and deliver to your door. MBI will spend the time in lines to get your cargo for you so you can be more productive with your time. Miracle Brokers, the solution broker. 345-925-5989 or miraclebrokers.com.
All right, folks, thank you so much for hanging in there. Let's continue the conversation this morning. And a beautiful good morning to all of you. It is Wednesday, August the 19th, a day after my birthday. And we are still going to be celebrating all the way into the month of August. Happy birthday to everyone who is enjoying an August birthday. And any birthday, really. Of course, we think August is the best, but, I'm sure everybody else is the best too. Let us have some additional information. Okay, so I want you guys to take a look at this picture and tell me, where do you think this photo was taken? Take a look at this. Where do you think this is? Let's do a few guesses. Where do you think this photo was taken? Looks crazy, right? This was just this weekend on Saturday. People hanging out at a pool party, and clearly no social distancing. They look like they're having a fabulous time at this pool party. And they're in their little floaties. They look like little kids hanging out with their floaties. Look at this. People in the water. I mean, this is like, it looks like thousands of people just on top of each other. They're touching each other's floaties. They're touching each other. And I'm sure they are all not all related. You know what I mean? This is next level insane. Let me have a look at some of your guesses. Evelyn says her daughter's birthday party today. Happy birthday to your daughter, Evelyn. So any guesses as to where in the world this could be? I think you guys are going to be shocked to find out. Any guesses? Any guesses? Anybody? All right, let me see if anybody's going to guess where this is. No guesses? All right, well, let me tell you where this is. Oh my gosh, Evelyn's daughter looks like a model. Hello. Rochelle is gorgeous. She just sent me a picture. All right, so shockingly, yeah, Rosanna, girl, you're on it. China. Edith, you are absolutely 1,000% correct. This is in Wuhan, China, the epicenter of this virus. So Edith, you're on the money. This is where the virus started, folks. And this is how much these people think. They've already had a second wave and a second outbreak and had to go back into lockdown, shutting down schools again. And look at this. Look at this hot mess. Unbelievable. And they're not the only ones who are out there partying beyond common sense. So everything from illicit raves to pool parties are happening at a large scale around the world. And of course, this is causing alarm for healthcare professionals. And they think that these people are definitely contributing to the uptick in the coronavirus numbers. Makes total sense. Young people. Wow. Wuhan, China, the city where the coronavirus outbreak began. This says hundreds of people recently swam shoulder to shoulder at a cramped pool rave, and no one wore a mask, that's for sure. And no one was social distancing, that's for sure. Shocking. It looks like thousands of people to me, but okay, if they say hundreds, we'll go with that. Italy was recently forced to shutter its nightclubs. Remember, Italy had a hard time there for a minute. Lots of people were dying. They were in the number one spot for a while before the US took over. So they have now had to shutter their nightclubs after an increase in cases. And this is the first significant crackdown in months. Lots of images in circulation in Italy, again, of people ignoring the mask requirements at clubs. So they still do have mask requirements in their clubs. In the US, people to continue to fight for their right to party, as they say. Now, here's an interesting bit of information. The median age of people contracting the virus in Italy has now dropped below 40. That's not good, folks. Not good at all. Not good. Medical concierge services are popping up for so-called wealthy people in the Hamptons and Manhattan to offer rapid screening for clients who want to host parties. And this is interesting because most people who want to get a test in the US now have to wait on average at least 2 weeks to get test results because all of their labs are woefully behind. So good morning to Odette. This is our situation in terms of our schools here. Demonstrating, there's a minister in the front with the black and white dress on, and a few others demonstrating how they intend to, expect children to sit there with their mask on and how they've spaced out the desk a little bit as well. So there are people in this photo from Public Works and so on, and they took a photo op, I think that was on Friday, when they were doing some of the school walkthroughs with the new procedures that are in place. So University of North Carolina, Chapel Hill has shut down in-person instruction for undergrads and moved classes entirely online after 4 clusters of infection. University life is school too, babes. It's crazy, folks. It's scary. So they've shut down now completely online. And again, they have said that university faculty members that most of the cases were traced to the quote unquote social fear of campus living. So in other words, frat parties, kids, teenagers, young adults socializing as you do when you go to university. I mean, who doesn't go to university and go to like a house party or something every once in a while? So they have now said, irks, online classes only. And the New York Times has also said at least 251 cases of the virus have been tied to fraternities and sororities directly. And, they tend to live in frat houses and they're sharing everything and they're having house parties, et cetera, et cetera. So that's some information about how the partying has contributed. Karen's son's birthday is on Saturday. So happy birthday to him, Karen, when that comes. So Edith says, yes, many colleges and universities in the US had to send home kids due to new outbreaks in colleges, and they're now going back to online learning. It's easier, I must admit. for them to engage in online learning for kids who are, a little bit older, right? So let's just see what else we've got going on here. Thank you, Edith, for that information. Now, listen, let's switch gears a little bit. Done with the COVID convo. Let's talk about some other things that are happening around us. So, big shout out to Alric Lindsay, by the way. Alric actually started his back to school drive over the weekend, handing out backpacks with goodies in them. And I actually had the opportunity yesterday to get my hands on a backpack and see what was in it. Man, they are full of everything. Wow, those kids in Windsor Park should be so lucky. I mean, they are lucky. Rulers, pair of scissors, eraser. They had highlighters, the dry erase pens, tons of, like, a whole stack of the notebooks, the writing notebooks, right? So they can practice their penmanship and taking notes in class. What else was in them? There was folders, highlighters. What else? It was tons of stuff. I'm like, wow, plus the backpack. So these kids are well set for the new year. So thank you, Alric. He's going to send us some video footage, which we're going to put up later, of the day. They did incorporate a little bit of fun for the kids. So they won the slides and were able to enjoy themselves while they were there to pick up their backpacks and get ready for the school year. So it was like a combination of, like, family fun day. I think they may have even had some food, but I'm not 100% sure. I swear I saw hot dogs somewhere in one of the pictures, but maybe not. Maybe I was just hungry at the time. So so family fun day and, picking up necessary supplies for school. So no kid should be going without this year, and in particular in the Windsor Park area. Thank you so much again, Alric, for that. So we've launched our community calendar, folks. So any events that you have, whether it is a volunteer event, sporting events, private school, public school events, send us your calendars and we will incorporate your calendars into the CMR calendar. And then the CMR calendar is conveniently located on our website on the left-hand bar for everyone to see. So you can check that out. There is a small fee if you're a business. So say, for example, you are a business and you want to do like a grand opening event or, a special event, you can get on the calendar, but there is a small fee for businesses to be included in the calendar. But if you're a nonprofit organization, by all means, send us your details because we want to ensure that you are included on our community calendar. Yeah, awesome. So I just wanted to make that announcement. Cayman Brac, the NAU office, is temporarily closed. If you live on the Brac and you're part of the NAU, like you're an NAU client, for example, on the Brac, please be mindful that that office is closed for maintenance. They can't say yet when it will reopen. So as soon as we are aware of its reopening, we will certainly advise you guys. Let me just see. All right, beautiful. So there's that announcement. The HSA had a bit of good news yesterday about some of their staff being trained to become shelter wardens. So let's not forget, folks, today is August the 19th. We are heading into what would be the peak of the hurricane season. So, this is critical time now because we have predicted, the experts, I should say, have predicted a higher than usual hurricane season this year. So make sure you're ready. Some people have recently invested in shutters and other preparations to get ready for this. I'm just trying to find the picture that the HSA sent across and shared with us. Let me just see if I can find it. But they're all wearing masks. And so now they have done additional training to become shelter wardens. So again, they're always looking for volunteers. So if you're interested in being a hurricane warden, by all means, reach out to that respective authority because government needs people who can, during a hurricane, step up to the plate and assist with doing their part. So here are some of the 13 people that were part of that trainee group. And they have done a number of training initiatives, again, to prepare themselves. You know, it's all about preparation, folks. You got to be ready for when these things happen. And so I'm so pleased to see that this was undertaken yesterday. So again, hats off to the HSA and hats off to the employees, these 13 individuals who decided to receive accredited fire safety and fire marshal training. And they had 2 instructors who are American Heart Association certified conduct the training at the HSA. So beautiful initiative here. Fire safety, fire marshal training, such important things to have, I think, under your belt. So they're going to be doing stuff like CPR, how to be like first responders, and those types of things. So again, congratulations to those individuals. Now, day before yesterday, there's a photo that we posted on our social media pages that caused a little bit of a stir for different reasons. So some people saw it and thought, oh my gosh, this person's homeless. You guys are making fun of a homeless person. So I just wanted to clarify that this person is not homeless. He was actually working at a construction site nearby. And he decided, I think, that he was just going to cool off. And so he jumped in the waterfall at Vela. And yeah, somebody said they don't know how clean that water might be, though, because it's like recycled water through the, you know, it's just there for aesthetics. It's not really meant for anybody to take a shower or anything like that. But as someone said, I don't know if that water's all that clean. He might get more germs from that than anything else. But you know what? It's hot. It's in the 90s. And he's probably like, let me just take off my work clothes, jump in here and get cooled off a little bit. But the person who provided the photo to us did provide information that this person was not homeless. They actually are employed. They're gainfully employed at a nearby construction site. And they were just taking a breeze out. So we posted it. Sometimes when we see something, we're like, we ourselves don't know what to say about it. So we just say, hey, what do you guys think? And that's why when we say caption this, it's like, yeah, what do you guys think about this situation? And so, you know, you caption it with whatever your thoughts are. And then that's it. Yeah, so he was, what can I tell you? He was just having a good time. So no harm, no foul. What else has been going on in the community? I'm just checking any final messages before we call it a day. I know more of you, like I said, more and more of you are getting back to work these days. Let me see here. So in terms of US political news, you know that the Democrats had their Democratic convention started the night before. So on Monday night. And so now Joe Biden is the official Democratic nominee for that party, for the Democratic Party, for the president of the United States. So he's the Democratic nominee, and they will be going to the polls, it looks like in November as usual. Speaking of the polls, the Prime Minister of New Zealand has delayed their election slightly by about a month, given this new outbreak. She has some concerns about the virus. And so, as a result of that, she has postponed it by about 4 weeks. So they were supposed to have elections coming up next month in September. Now they will have them in October instead of September. And basically, she said, listen, we're going to give the parties a chance to organize themselves and to make sure that they can safely have meetings and conventions and whatever they need to do in order to get ready for the general election. And in Jamaica, things are in the swing of things. Yesterday was actually nomination day. So candidates were all over Jamaica being nominated for their various political offices there. I don't know how many people, when we get a chance, we'll do an interview with Danica, who's in Jamaica. She lives in Jamaica, and she's a regional correspondent, and she can kind of give us an idea of the vibe of what's going on in Jamaica. But I do know yesterday she was actually on the street quite a bit, out and about, covering, and getting footage of what's happening there in terms of the election and the nomination day. So we have to see if there's any footage for us from her. So yes, they're having elections coming up here shortly. I think it's always interesting that certain countries, like Jamaica is one of them, they don't give the country a whole lot of notice that an election is coming. Like, we know, I guess, that this is election year, but literally last week they announced nomination day. September 13th, I believe, is actually election day. So it's like, boom, nomination day, election day, it's happening the next month kind of thing. It's like, whoa. And already people are out protesting and doing the most in Jamaica. I did see some video footage of someone, there's some candidate in a particular area, but I guess that area is a stronghold of like the other political party. And they would not let the candidate in that area. Like, there are women out there, we're not going to let you in. And I mean, I thought, wow, this is political ignorance at its best. But they were physically preventing this person from going into a particular area, which is just crazy. I think that's what they call garrison style politics. I hope that Cayman never gets to that level of, just ridiculousness. And of course, that's one of the concerns about single member constituencies and, party politics taking a stronghold in any particular area. So, of additional interest, you may be interested to know that here in the Cayman Islands, the Ombudsman Office issued a statement the day before, so on Monday, that they were just reminding people of their legal requirements under the data protection law. Because, now listen to this craziness, there was a whole bundle. Did you guys see this story? I thought, this is crazy. There was a whole bundle of files and information that somebody found and they took to the Ombudsman Office that contained, let me tell you what it contained. Hold on one second. I don't want to get this wrong, but it was coroner's reports and other things. I'm going to tell you what my theory is on this. So they wouldn't say who it was from. They said they couldn't prove who it was from. I don't think that that's really the case. They probably just didn't want to waste time even looking into it. But I honestly believe that these files, whatever these documents were, would have been from the court's office. And I'm going to tell you why I believe that. Let me find the article so I can tell you. So it's autopsy. So records containing personal data abandoned at the Georgetown landfill. So the Ombudsman's Office issued a warning to people, businesses, and even individuals to be careful how you're discarding personal data and you're using what's called best practices. And there are things in the law. So if you're not handling people's data correctly, you can be fined upwards of $250,000 under the new data protection law. So they found court records, publicly available court records, handwritten notebooks in shorthand, and autopsy reports, some of which contain confidential and sensitive personal information at the dump, at the landfill. And so those are the types of things that people who work at the court's office would have access to. And this is what one of my sources said to me. And I thought that this was interesting. Let me tell you what my source told me yesterday. This is someone who has knowledge of the court system. And they said, let me just try to remember where this conversation was. Yeah. So they said the handwritten notebooks, listen to this, the handwritten notebooks is what the magistrate or judges use every single day. Then, of course, the autopsy reports and public court documents. And they said that this sounds like this could have come out of the courthouse. And that this person knows for a fact that in the criminal registry, there have been concerns with storage and disposal of documents dating back for many years. So someone speculates that they would love to see those documents, but from what they have read, it sounds like documents from the coroner's court. Interesting. So, within the court, there are multiple, what do you call it? There are multiple different courts. So now they have like a mental health court, which basically, I didn't know about that until recently. They've got a drug court, so they just focus on things related to, drug usage and so forth. They have traffic court, which is obviously traffic. So they're starting to do more specialized court hearings and stuff. And like a particular judge or magistrate will then be assigned at a particular day. You're just dealing with mental health cases today and so on. So yeah, very, very interesting, folks. But that's scary because autopsy information, that is super personal. I mean, obviously some of that information becomes publicly available during the autopsy hearing, but a lot of it still remains very much confidential information. So folks, be careful, know the data protection law, because if you are in the business of certain types of collecting information, whether you're a bank or whatever, you are categorized as someone who falls within the responsibility or the remit of the data protection law, and there are hefty fines that go along with that. So Charlene has weighed in on the face mask situation. Sue reminds us that Chris Saunders has been doing that for the Bordentown kids as well. Yes, and in fact, Chris is now, I think this is Chris's 3rd or 4th year that he has been preparing his school kits and doing that. And he does personal deliveries every single year. So hats off to Chris as well. Charlene says it's her personal opinion that children should be wearing both masks and shields for their own safety in schools. And outside, it should be mandatory in social discipline and distancing. Charlene, thank you so much. It was a very good birthday. And Nikisha reminds us that Election Day is actually September the 3rd. So basically 2 weeks away. Nomination Day, and then 2 weeks after that, a little bit, 2 weeks and 2 days, is actually Election Day. Very short space of time, don't you think? But some countries do it that way. They don't give a whole lot of time. I don't know why that is, but they do not. They don't give a whole lot of time in terms of those responses. So super, super interesting. Again, thank you guys so much for all of your comments. Thank you for tuning into the show. Tomorrow would be Thursday already. Whoa, the week just is flying by. So I invite you all to join in again at 7:15 tomorrow morning. We'll talk about whatever's happening in the community, what's topical. But again, there is this petition in circulation. You can check it out. I'll link the article in the comments. And the question then becomes, should children have to wear masks, in schools? And there are parents who are petitioning saying that no, they don't think that they should. And that children, I guess, are going to struggle with it. And parents just don't want their kids to have to do it. So what do you all think? What about mandatory testing? I wonder if those same parents would be open to mandatory testing of their kids for the coronavirus. So you don't want your kids to wear masks before going back to the classroom environment. Would you be open to having your kids tested? It's a good question. Okay, I think that's it. Nomination day. We should have some video up later about what's been happening around Jamaica from our regional correspondent. Again, she actually lives in Jamaica. She's stationed in Jamaica. And she will provide us with some footage there in terms of what's going on. So lots going on around the world, a little bit going on here in the Cayman Islands. People are getting back to work. There's still a lot of government workers who are working from home. So remember that tomorrow is Tech Thursday, folks, where we will have a little bit of open discussion, but we also focus on tech-related things, so technology. So I do want you guys to tune in for that show. And if you have any recommendations or suggestions about topics or things that you'd like to hear about for Tech Thursday, please, by all means, tune in. And we would love to have you join in the conversation, or, just give us show ideas in terms of what you guys are most interested in hearing and learning more about. So straight up, by my clock, it is 9:14, so we got a couple seconds left. But I thank you guys so much for tuning in. This is only a 2-hour program, folks. I know some days we feel like we want to go more, but everybody's busy and people have got things going on. So we want to just bring you guys up to speed as quickly as possible. Wish you a fabulous day. And we will be back here tomorrow morning for another edition of the Cold Hard Truth. So please enjoy the rest of your day and stay safe.
Thank you for tuning in to another edition of the Cold Hard Truth. Make sure to check Facebook for showtimes and more information and the latest news at CaymanMarlRoad.com. Subscribe to our IG and Facebook pages to get the latest happenings.